This is Elizabeth Auchincloss, and this is episode 8 of the Psychoanalytic Model of the Mind. In this episode, we will talk about the third model of the mind called object relations theory. In the 60s and 70s, it gradually became clear to many theorists that some behavior and many states of mind are best described not in terms of conflict among structures of the ego, the id, and the superego, but in terms of internal representations of self and other. It also became increasingly clear to developmental psychologists that many mental capacities previously attributed to the ego could best be understood as developing in the infant-caregiver matrix. In the midst of these two developments, object relations theory was invented. An object is the word that psychoanalytic theorists use to describe another person. An object relation is defined as a psychological configuration consisting of three parts. 1. A self-representation. 2. An object representation. And 3. A representation of an affectively charged interaction between the two of them. When we use the term object relations, we are referring to psychological representations. In other words, object relations must be distinguished from interpersonal interactions, a term that refers to the relationship between an individual and another person in the outside world. Some basic facts about object relations include: 1. Object relations are largely unconscious. 2. Object relations range from fleeting to enduring. 3. Enduring object relations are examples of intrapsychic structures. 4. Object relations are formed during development in interactions between infant and caregiver. 5. Object relations are built from a mixture of the inner needs, thoughts, and feelings, and the actual or real qualities of the infant and the caregiver. 6. Object relations are on a continuum from highly realistic to highly distorted. And 7. Object relations serve as a template for all future relationships. Object relations theory attempts to understand how self and object representations develop in childhood, how they are maintained throughout life, how they influence and are influenced by other structures and motivations, and how they impact psychic functioning and behavior. Object relations theory makes assertions about all the other basic aspects of mind, including motivation, structure, development, and psychopathology. These assertions are: 1. Human beings are object-seeking from birth. Object-seeking is not reducible to any other motivation. 2. All psychological experiences, from the most fleeting experience to the most stable structure, are organized by object relations. 3. Object relations are built up through the internalization of the infant's interaction with the object world. Object relations develop from a mixture of innate factors, including affect dispositions and cognitive capacities, and interactions with caregivers. 4. Interpersonal relationships reflect internalized object relations. Psychopathology, especially serious psychopathology, is best conceptualized in terms of object relations. Object relations theory also includes several major revisions to our understanding of how psychodynamic psychotherapy works. To better understand object relations theory, it might be helpful if we compare the basic tenets of this theory to the basic tenets of the structural model of the mind. Object relations theory differs from this earlier model by making the following assertions. 1. The search for objects is irreducible to a search for bodily and/or aggressive pleasure. Wish and drive may be important motivators in psychic life, but they must always be embedded in self and object representations. 2. The basic unit of experience is an object relation, as opposed to a conflict between a wish and a prohibition. All psychic structures, not just the superego, are made up of object relations. 3. Caregiver-infant interactions are central to all aspects of the developing mind, not just the superego. Pre-Oedipal interactions involving the infant-mother relationship are just as important to the development of the mind as are Oedipal interactions. The establishment of stable object relations during the pre-Oedipal period of development is a necessary forerunner to the development of the Oedipal phase. 4. We will discuss the implications of object relations theory for the understanding of psychopathology and treatment in greater detail in a moment. Some famous theorists who are important to object relations theory are Melanie Klein, who is the earliest object relations theorist. She coined the terms the depressive position and the paranoid position. Ronald Fairbairn, who coined the term object relations theory. John Bowlby, who invented attachment theory. Mary Ainsworth, Mary Main, and Peter Fonagy are other important theorists of attachment. D.W. Winnicott, who coined the terms the good enough mother and the holding environment. Wilfred Bion, who invented the terms the container and the contained. And Margaret Mahler, who invented the terms separation-individuation and the rapprochement crisis. We don't have time to talk about all of these theorists, but we will talk in greater detail about the American psychoanalyst Otto Kernberg. Otto Kernberg has done important work integrating many of the best aspects of object relations theory with the best aspects of the structural model of the mind. For example, in Kernberg's view, the experience of drive results not from the body's innate demand for pleasure, as we find in the structural model of the mind, but from an innate disposition to experience pleasure in the context of relationships, which leads people always to seek similar pleasurable relationships in an ongoing way. In other words, pleasurable or good experience in the context of relationships gets organized as a drive. Kernberg has also developed an important system for classifying personality organization and a theory for understanding borderline personality disorder, both of which reflect his efforts to integrate ego psychology and object relations theory. According to Kernberg, in the development of healthy object relations, every individual must succeed at two basic tasks. The first task is the ability to differentiate self from object, or to construct self and object representations with clear boundaries. The second task is the ability to integrate self and object representations with respect to their good or pleasurable and bad or frustrating aspects. In line with the thinking of others whom we have mentioned above, Kernberg sees the successful development of object relations as the attainment of object constancy, or the ability to maintain a positive attachment to an object even in the face of need, frustration, or anger. The twin tasks of separating self from object and of integrating good and bad aspects of self and object are closely related. This relationship is seen in many instances of psychological stress. For example, it is seen in the common experiences that involve separation from loved ones, in which we all face difficulty managing feelings, which often include frustration, need, and anger. We must be able to withstand these feelings without either losing the capacity for self and object differentiation, task number 1, or the capacity for object constancy, task number 2. According to Kernberg's classification of personality disorders, patients who frequently fail at the task of differentiating self from object, task number 1, are prone to psychotic experience. Patients who frequently fail at the task of integrating good and bad experience, or task number 2, but succeed mainly in task number 1, are prone to borderline psychopathology. And patients who usually succeed in tasks number 1 and 2 are prone to develop neurotic psychopathology. In Kernberg's view, borderline personality organization, BPO, is characterized by object relations in which there are poorly integrated good and bad self and object representations. BPO is also characterized by the use of defense mechanisms based on splitting, such as projective identification and omnipotent control. These defenses are based on the need to separate positive from negative experience and to get rid of negative experience through projection onto the object, who is now experienced as bad and potentially dangerous. In other words, the defenses characteristic of BPO reflect the underlying disturbances in object relations. To review, all psychoanalytic clinicians, in addition to Kernberg, agree that the evaluation of object relations is an important parameter along which to look at all mental health. In general, object relations are assessed as mature when an individual is able to sustain and utilize loving attachments. As we have said, this ability requires the recognition that the object is distinct from the self and that one's own needs may sometimes conflict with those of the object. It also requires the ability to accept some degree of dependence on the object as well as some degree of separation from the object. Mature object relations also require the acknowledgement, acceptance, and tolerance of ambivalence towards the object. Mature object relations are also marked by self and object constancy, allowing for the feeling that the self and the object are good enough. Throughout the life cycle, we face constant threats to object constancy posed by any event that increases separation from loved ones or feelings of vulnerability and anger. Actually, object constancy can be threatened by just about any strong feeling. Obvious examples of these threats include adolescence, often called the second separation individuation, when we face the challenges of leaving home and of finding new people with whom to identify. Parenthood, when we face the many feelings that come with having a baby. The midlife crisis, when we face the fact that life does not go on forever, to mention a few examples. As we have seen, ongoing constant failures of object constancy are part of all kinds of severe personality disorders, including borderline personality disorder. Although it is possible to describe serious personality disorders in terms of ego weaknesses, such as impulse control and affect tolerance, we can better understand these disorders if we understand that they reflect an inability to maintain loving relationships in the face of frustration or on failures in object constancy. Many patients with severe personality pathology do not form attachments at all because they are afraid of the intense feelings that will be stirred up by an intimate attachment. Others are unable to tolerate separation. Many suffer from problems with both attachment and separation. Object relations theory has also made many contributions to the understanding of psychodynamic psychotherapy. First of all, we see this contribution most obviously in the specific psychodynamic psychotherapies designed for the treatment of borderline disorders. For example, Kernberg's own treatment for borderline personality organization, called transference-focused psychotherapy, TFP, is based on his object relations theory of borderline personality disorder and borderline personality organization. TFP is based on the premise that underlying object relations are activated in patient-therapist interactions. Therefore, it emphasizes work in the transference as offering the most effective means of addressing these underlying object relations. A primary task of the TFP therapist is to observe and to interpret pathological object relations as they are activated in this patient-therapist relationship. However, we see the influence of object relations theory in all psychodynamic psychotherapy, not just those with severe personality disorders. Most obvious is a change in the goals of therapy to include not just the aim of understanding wishes, prohibitions, and ideals and the habitual modes of managing conflict among them, but the aim of building strong relationships with other people. The therapist using object relations theory is very interested in how each patient finds attachments and intimate connections that are sustaining and how each patient maintains a sense of separateness. This therapist is also interested in how each patient does or does not have internal structures marked by self and object constancy, which support a sense of being good enough. In addition, we see the influence of object relations theory on how psychotherapy is conducted. For example, we see this influence in the strong emphasis on the use of countertransference, defined as the therapist's feelings about the patient, as a primary source of information about the patient's inner life. We also see the influence of object relations theory on theories about how psychodynamic psychotherapy works. For example, over time, theories have begun to emphasize the importance of the patient-therapist relationship, not just as a source of information, but as a force for change. In other words, in general, we have seen a shift from early theories of therapeutic action emphasizing change resulting from insight derived from interpretation to more recent theories emphasizing change resulting from the relationship with the therapist. However, we need to remember that the argument over whether interpretation, as opposed to the relationship between the patient and the therapist, is more important to therapeutic change is no longer as important as it once was. Nowadays, we must integrate many theories of therapeutic action, including both the role of interpretation and the role of the relationship, which work together. This ends episode number 8 of Object Relations Theory. For a review of what we have discussed, see table number 8. Stay tuned for episode number 9, in which we will discuss our last psychoanalytic model of the mind.